trash is so like that. I don't know how she could like sat of the edge.
You could count, she had like a six-pack, you could count her abs.
And her bicep.
She had a little ball of bicep. But for me, the most concerning was the decubitus on her medial malleolus. That's the most concerning for me because, as you all know, that can
Spread and
travel up the fascia, hop a ride.
turn into huge overall problems.
right.
The child you're talking about, is that the child that we saw, one of the twins?
No, Chris Maybe. Yeah, I've been following her for 3 years. We have been following her for 3 years. And she was born with lots of problems, severe cerebral palsy, and the first year she was very bad, last year better, and this year she's kind of gone bad again. So
Wow.
the family has 0, 0, 0. The stepmom is pregnant again, so that's, going to give her less attention. But so what did you guys feel like, was there anything that you think would have helped her? Or if you had to make a list, kind of like, okay, the first priority is, and then down.
Some sort of repositioning, I mean, even if it's not like a seat with supports, but some sort of maybe seating chairs with all different kinds of supports that get favored in that sort of state to be at least somewhat upright for a little bit of the day. Just looked like she was back there in the same position constantly. So I would say repositioning to prevent more ulcers. Like you were telling, like pulmonary hygiene is a huge issue when you're lying flat.
Well, yeah, and we talked about that she was sounded very like raspy and trouble breathing sometimes standing upright. Yeah. Even on a little incline with a couple pillows.
Right. So she would finish with, so the ulcer is a big priority, and then getting her upper positioning, but with her, you held, did everyone hold her?
I just held her.
Meg was, she's teeny. I mean, she's tiny. If you put her on a scale, she's tiny, but she's so postured so much. I mean, I was having a hard time holding her. I thought I was going to drop her because she was so just stiff and hard. So
She never relaxed
No.
the entire time that we were holding her. Like, it wasn't just like she was trying. Classic severe CP.
Right.
Like some like
Just
very,
tonic
very
contractions. Yeah.
Yeah, and we included our case study when you talked to us about possibly talking to a neurologist about getting the medicine that she used to be on to relax.
So mom said she used to be on medication, but they ran out. So yeah, so if we could get some kind of neuromuscular relaxant into her, that she could at least be inclined a little bit for the pulmonary hygiene piece of it. I mean, when I was in the first year, I thought that she would probably pass away within a year. When I saw her, I thought that she probably wouldn't be here next year because of pneumonia. I've been worried about her skin, and so we'll bring some stuff up tomorrow, and then look, the nurses are coming on Sunday, so this is perfect because they'll be able to, probably a week out they'll be able to see But stepmom was 8 months pregnant, and her belly is like 4 or 5 months. She's tiny herself, but you can see she looked very pale with dark circles and very anemic, certainly. So, there's a lot going on there. But she asked for Pampers, so we brought her Pampers, which she was obviously very soiled. Grace Mary was very soiled, so at least getting her clean Pampers would protect her skin also. So that's one thing I can do. I have to say, overall, she looked pretty content. The first year we saw her, she was crying and shouting the whole time, the whole visit. She was crying, yelling. Stepmom said all night long nobody slept because she was screaming all night long. But she is better. I mean, it's hard to see that, but she actually did seem, she was smiling and laughing and she was shrieking. Believe it or not, she's actually a lot better. So, in that way, so I think if we can get the skin taken care of, get her something for her tone, So case studies are what so far? Great.
We tried to put a name. Most of them have names. I think some of them we just didn't know.
You can just tell me, just tell everyone.
So case number 1 was a 44-year-old Ana Rosario, I think this was it, from the First Days Clinic. And she was the patient who was in a car accident 4 years ago. She had symptoms about 1.5 years ago on her left distal surgery. Okay, on her left distal femur. Second day?
Yeah,
Oh,
second
second
day.
day, okay, sorry. And then her body rejected the hardware, so the hardware was protruding from her distal femur, or at her distal femur. And
Like through the skin protruding? Or
Yes.
through the skin?
Like it looked
Like
like,
it's-
I thought it was an external
we all
fixation.
thought it was-
Everyone thought
we
it
all
was
thought
an
it was an
external
external fixation, and it was the internal fixation. So, I guess she had an infection in the past there, was taking antibiotics, but either she ran out or the prescription was done. Her leg was really short, right?
Mhm.
Yeah, so she had a severe leg length discrepancy, and plantar flexion contracture, slight knee flexion and hip flexion contracture. It looked like, I don't know if we actually fully assessed that, but she definitely was in those positions, or if it was even further off.
Okay.
Yeah. So we went through gait training with her.
I told them like